Welcome to episode 13 of Starting with IEP. I'm your host, Flor Amelia, and today we're continuing our powerful conversation with Dr. Heller in part 2 of our interview. Part 1 left us with so many important questions still open, like evaluation, school accountability, and the deeper issues that parents keep running into. So today we're picking up right where we left off and make sure that you get all the clarity that you deserve. Dr. Heller brings transparency, expertise, and a level of honesty families rarely get access to. Whether you're joining us or coming straight from part 1, this episode will give you practical insights you can use immediately at your IEP meeting. Before we jump in, here are your episode 13 action items. Well, the first thing is that you can do is grab a notebook. You'll want to write down the red flags and green flags Dr. Heller breaks down today. Number 2 is download your free IEP checklist using the link in the show notes. Number 3 is share this episode with a parent or educator who is struggling with evaluations or still unclear on school decisions. Number 4, share this episode with a parent or educator who is struggling with evaluations or unclear about school decisions. Subscribe to the podcast so you never miss an episode. And you can also visit our website at startingwithiep.com for more tools, guides, and upcoming events. If you want to share your story, challenges, or wins on the podcast, fill out the Be a Guest form on our website. We'll love to interview you. Well, all right, let's jump into part number 2 with Dr. Heller. Hi, Dr. Heller. Thank you so much for coming back. I'm so excited. We didn't get through all of our questions, and I really do want to thank you for returning back so that way I can continue asking our questions.
Yeah, absolutely. Yeah, happy to be back. Thanks for having me back. I'm glad we can continue and happy to answer questions and be helpful.
Yes, very much. So the first few questions that I have, many questions that I have, is that I want to start asking questions about when families read and they want to understand the report. But I remember that when I first was given a report, I didn't know where to start. And I really wish that they would have done a better job in telling me which section. So I guess this can be your opportunity to help many families that are just starting to get the diagnoses or really understanding what an IEP is with these evaluations and how critical these parts are. So for the families that get like these 20-page packets, what are like the first sections that they should focus on so they don't get so overwhelmed with the whole packet?
Sure. In a lot of ways, the summary section can often be good. And that, depending on how they're written, they usually do with their summary section. They summarize the findings. Some of them may give a lot of details about specific scores. Others may just do a more general summary. But I think just understanding here's a snapshot of what does this all mean? Looking at different areas of functioning, and then what does it mean as far as what are the diagnoses? What are the findings? So I think the summary section and the recommendations are probably the two most important sort of things of a report, because there are definitely people, professionals, I'm sure, that skim the rest of the report and look a little more closely at the summary. So I think that the summary and the recommendations are probably the two most important sections of a report to look at.
Thank you so much for that. I think when I first started, I did do that, but I felt like a parent that was the person that, where you have a book that you have to read. And then you try to, instead of reading the book, you go to these notes, I guess Cliff Notes or something like
Oh,
that.
there's like Schmoop, I think. Is that what you're thinking of?
Yes, yes. So I guess for me, I felt like I was cheating my child if I just went to the summary or recommendations. But I guess hearing you, I feel if I would have heard you back then, be like, it's okay to start there and
No.
then work
Well,
your
because
way
I
back.
think a lot of it is the reports are a lot of times can be very long. And I have a feeling most professionals are not going to read the entire report from start to finish. And I think each person based on their needs are going to look at the report and look at different sections. For example, if I get a report from someone, I may not read the entire thing from start to finish, but I'm going to look at the direct data. So I'm going to see what does the data say. So I might look at tables. I would look at different parts in the main part of the evaluation of not just what is the score, but what are the behavioral observations? How did they do on stuff? So the point is that I think each professional is going to have different parts of the report that they're going to look at more closely based on what their needs are.
Yeah. So I remember when I was looking at the summary, if they would talk about a certain section more or like the weaknesses that they saw or what they need to work more on, then I focused on going back to the report. And that's what you said about looking into the data. I focused more on that data so that conversation during the IEP can be more efficient with the times. One of the things that I also, as I'm just like trying to go back, how did I feel when I first didn't understand about reports? I guess I was very blessed to have a strong advocate on my side that was my daughter's private psychologist. And She definitely gave me pointers about, hey, Flor, this section, you may want to ask this question. So she would basically tell me where in my daughter's report would be like some red flags for her. Can you, in your experience, can you tell me like what you think might be red flags for you if you were to read a report and be like, this doesn't sound right or off? I'm not sure if you have encountered those though.
You mean like a question where it seems maybe there's an issue with how the evaluation was completed, that kind of red flag, or?
Yeah, that may indicate that the evaluation was too limited. Not enough was done on the
Yeah.
evaluation.
It's a little hard to say because each situation is different in terms of what the needs are. But I think if a parent has a lot of unanswered questions and there's no sort of clear attempt to look at certain things, like if, I don't know, I wonder, does my child have a lot of anxiety? And there was never asking the parents about anxiety, not asking the child, no rating forms of any kind done to look at anxiety, then that might be something to have a possible concern about. But it depends. Same thing if, let's say, if a parent wondered, is there autism? Again, if there's nothing in the referral question and there's no other information to suggest that there could be autism, maybe it's probably something that a clinician looks at informally as part of the evaluation, but may not do any formal measures and may not note that directly in the report because there's no need to if there's no concern at all about that. So I think the main thing is if you have concerns, my suggestion would be to talk to the person that did the testing, explain your concerns. They maybe would explain stuff, even if it's not written in the report about it, and figure out, do they need to do more testing? Did they rule it out and just they didn't note it because there's no need to in the report?
Hmm.
Or is it that there was too much else going on to really make a determination on something? Because the hard part is when there's so many different issues going on at once, sometimes it can be hard to really examine everything as closely as would be ideal because of the fact that you're not going to get a clear picture of certain things. If there's a lot of anxiety and depression going on, certainly you could look at ADHD, but you're probably not going to get quite as clear a picture as if there was nothing else going on and it was really a question of is there ADHD or is there not?
That is great. This actually reminds me of a time where the evaluation didn't sound too much like the child. And so I remember a parent requesting to talk to the evaluator separately before the IEP so they can review it. And then that was the time when the parent really got to know what the child how they engage with the classmates because like the environment is very different from home to school. So she was able to get that more of an understanding of the report that was written about her child. There was a lot of depression that mom mentioned that the evaluator didn't know about. So during that time, then the evaluator can be like, yes, okay, now that I know before the IEP, I can do a separate part to talk to the students and get to do a deeper dive on that part. But I thought a separate conversation was really great for that family.
Yeah, and in general, I think the more upfront you can be about stuff at the beginning, that definitely makes it easier because it
Yes.
definitely is harder to go back and try to do more stuff after you finish the evaluation. So being able to be upfront, if certainly during the intake session, share your concerns. Hopefully, the intake session and any sort of forums you complete are thorough enough that it gets at most questions. So there shouldn't be a lot of major things that weren't said, but it happens. And even if after the intake session, if you as a parent think, oh, there's all this stuff I realized I never mentioned, figure out what's appropriate if you can send a psychologist an email or secure message or however they handle that kind of stuff, give them that information so they have it. Because it
Yes.
makes it much easier for them to do a more thorough job in looking at everything.
I think that's a great point. I did work with a family once where they were very against being upfront. I love how you made that recommendation. They actually didn't want to tell the school that the child was already diagnosed with bipolar and schizophrenia. And they were like, I just want to see what they think that it is because they were just trying to see if they're both the medical diagnoses and then the school during the evaluation, if they were also able to do that. So I didn't think that was like the best way to.
Yeah, it's definitely usually better to be upfront about it. To also keep in mind is that when you do evaluations privately, depending on what you're doing testing for and things like that, sometimes some clinicians can write a redacted report for academic purposes. So if there's stuff that's pertinent to the evaluation that maybe a therapist would look at, but that you don't necessarily want a school knowing, you can't usually remove diagnoses or anything like that in most cases, but you can certainly sometimes remove more sensitive background information or other details. And so that's also a way to do it where you have the full report that a therapist or other professional can see, and then you can have a school version that you share with the school. Protect privacy for things that aren't directly related to academic purposes.
But I guess for in this case, a lot of the interfering behaviors were due to those.
Right. So it is hard. There are a lot of cases where you can't really separate it out and you have to include everything in a report. The child a disservice by not, because then the school has no idea what's actually occurring and how best to target it in terms of helping them.
But you're saying that families, of course, there are families that just prefer not to share, so they can have a private evaluation and then they can ask the therapist to please don't mention it in this report.
What I'm saying is someone gets a private evaluation, they get the full report. Some clinicians are willing to write a redacted report for academic purposes, which basically
Exactly.
is essentially the full report, but it removes some of the more sensitive background information and maybe doesn't go into as much detail and maybe aspects of emotional functioning. But the caveat to that is you can't usually remove diagnoses, so it has to be accurate and it can't be misleading. So if there's things you can take out of a report to help protect privacy that don't take away from the overall findings, then those you can often do that as in some cases that helps address some of the concerns parents may have about sharing too many details with a school.
So I worked with many families, and so I remember with box cutter, one of those box cutters. And I guess their child, who was in elementary school, he would have the box cutter out and then he would ask the person to, hey, turn around. But if the person were to turn around, they can get hurt by the box cutter. So that's one of the things that the parents would share, but don't want it to be in the report. But it was still in the report. But are you saying that parents can request certain parts because they are sharing things, but there's certain parts that they don't want it to be in the school report? Are those like the type of things that you're saying that the parent can request to be redacted out?
Again, I think each case is different because it depends on what's going on with that and how many details. So, for example, it depends if was it like a harm to others. What was the motivation behind the box cutter in that case? So, I think probably there may need to be some mention of it, but I don't think you have to go into probably a huge amount of details about it. And if there are ways sometimes to say stuff more generally. So, for example, I don't know, depending on, let's say someone had, I don't know, a suicide attempt, for example, that for a school report, it's important for them to have some understanding of the severity of things to watch for signs, but you probably don't have to give a play by play of every single detail related to an attempt.
Yeah, I understand about keeping it private, but also still sharing.
Right, because the thing is, because if you look at it, if you don't put important information in, and the school is not going to be aware of stuff, and then they may miss things, and something really problematic could happen, and they're not able to fully support the child if they don't actually know all the details. But you don't have, or in terms of the big picture things. But I think you don't have to put. I think there's ways to maneuver around to not have to share all the intricate details of things if it's
I
not
love
as relevant to things and to understand the bigger picture of things.
I love how I think you use the word precursors or the things that may happen or to see what happens before the behavior, just so they can know, hey, this kind of seems similar to what mom or dad was sharing about that one time, but not share like too much. Because I understand about this whole privacy part, which is really important for families. But I also think it's very important that we do share with schools. But I love how you said that the families can still feel comfortable, summarize what had occurred. And the reason why that family shared that part is they were trying to give an example about how the student has a difficult time separating reality with imagination. So they were just basically copying something that they saw on YouTube. I think it was like these minions that were playing with a knife. So the fastest thing that they knew they weren't allowed to touch a kitchen knife, but the box cutter that dad typically uses for work was available. Mom was just trying to share. It's really difficult to, but that was the example that they put out. But thank you for that. I think that's really important for families to know better ways of sharing information, but in case they are afraid of sharing too much information, a better way to summarize.
And I think it's also important to be upfront that parents can also ask whoever's doing the intake and how the testing works, what information would be included in the report. And the clinician has a right to include whatever sort of makes sense to and is relevant in the report. Parents certainly could say, is this something that you would be able to not include? So you can also be upfront in talking about it at the time. But obviously, there's no guarantee that a clinician would say that they could withhold it because if it's relevant to the evaluation, there's an ethical obligation to include certain things in a report.
For example, it would be if they want to hurt themselves or others, that has to be included, correct?
Right, because the problem is if you don't share that, then there's no one's going to be aware that that's an issue and signs can be missed. So that kind of stuff. Again, you don't have to go into a huge amount of details about all of it, but something like that sort of is not something usually is appropriate to remove from a report. Yes.
Mm. Yeah, I think sometimes certain evaluators, I want to share that they don't do a great job in the beginning saying those things. I have been in a lot of meetings where it's more about like the emotional trauma that the child has gone through. But then they don't share the part like saying, hey, whatever you do tell me, I do have to put it, but they don't say if it comes to in details with if it hurts others or if you're going to tell me about the child hurting
Right.
themselves.
And I think it's also hard because I think there's obviously an ethical obligation to be upfront about the informed consent on what gets shared. But there's also the point if you focus too much on that, people aren't going to disclose information to you.
I know it's like yeah, it's a hard position to be, especially if you haven't established trust with the psychologist, right? That must be difficult as well.
That's also why it's important to build. Again, it's probably a little bit different for doing a parent intake session versus if you're doing an intake session for the client directly or for the child, you're going to build rapport as part of that. For the parents, usually you don't spend quite as much time building rapport in the same way.
That's true. Yeah, I often tell families that if mental health is something that their child is struggling with, I often tell them you need to find a consistent psychologist or psychiatrist that they need to regularly meet. I'll often tell them don't be reactive. You need to be proactive, especially if you're seeing those signs. So that way they can be a stronger advocate if something were to happen at school.
I think it's definitely good advice. It's important to be proactive and not just reactive.
Yes. But in these recommendations, is it okay to ask them? Because I mean, I have seen it, right? They're able to do it from English to Spanish, but is there a way? Because there's different reading levels for families. I work with families that they have not graduated high school. So these reports can be very intimidating for them. Some of them, if they come from another country, like English, or even if it's in their own language from the country that they came from, their education in their country where they came from may not be so great. So reading for them might be difficult. So I know I was just wondering, is there a way that parents can recommend the reports to be giving in plain language instead of just having, because there's just some reports like full of jargon.
Yeah.
Oh,
But I think that's regardless. I realize obviously the level of reading ability certainly impacts things. But even for people that have a very high reading level, if you don't have a background in this, a lot of jargon is going to make it hard to fully understand it anyway. I think a lot of clinicians certainly, I know it's something I try to do in terms of when I'm writing reports to try not to use too much jargon and explain in plain language what I'm referring to. So I think a lot of clinicians certainly try to do that. But I think certainly if there's a civic concern, you could mention that up front before someone writes the report would
oh,
be
that's
good.
good.
So I think
That's
like
really good
mentioning, this
advice.
is the concern I have. I want to make sure I'm able to understand the report, or maybe my reading level's not as high as could be, and I want to make sure I'm able to understand it. Because again, I think you have to figure out where's that balance in terms of someone writing a report in a way that someone could understand versus the idea that hopefully you would go over the report during the feedback session. So that would make it easier to make sense when you read it on your own, or providing some sort of separate summary report. Or what I'll do, for example, with kids is, I mean, I like to meet with kids most ages, go over the feedback in some age appropriate terms. For even for a teen, sometimes I will take the recommendations and rewrite them in more age appropriate language. So it's for younger kids so that they can look at them in a way that's easier to understand than the way I might write it for an adult to read. And being able to create something like that, either for the kids or for the parents or both, can sometimes be helpful if you need to have a more formal way of saying stuff, but there's a concern about the parent understanding everything in the report in the way it's written.
Yes, you reminded me of a case. He is, I want to say, I think he is 19. He read his report from his dad wanted him to understand himself more because sometimes he thinks that his dad is exaggerating. He's, oh, dad, you just don't know me, you just don't understand me. So, dad got this evaluation done with the consent of, because he was an adult. But then when he read the report, it crushed him. I don't know if I shared this with you before, but it really crushed him. It said mild intellectual disability. But for him, he's like, I don't have that. That is not real. That's not true. And then he's reading parts and he's, oh, and right here, Flor, it says that most likely I won't be able to live on my own. And for that, he went depression hardcore for, I want to say six to 7 months. Yeah. But how can it be that when a young adult is, because he wanted to drop off of Montgomery College, because he's like, over here says I can't live on my own or I won't be able to. So why go to college? Why finish this? Because he wants to be an engineer. How can we prepare if they're going to be reading their own, especially because it was requested that it can be worded in a way that he can also take in that information?
Yeah. So I think that's why it's important for that kind of thing that someone doesn't just read a report on their own, ideally. So whether it's ideally if they have a therapist, but that they go over the report together or maybe go through parts of it and talk through it, because I think being able to process it with someone, I think makes a big difference in terms of it not being quite as jarring when you read through a report yourself, but also recognizing when is someone in a good mental place to do it, or are they not really in a good place where they should read through the report themselves at that point.
Yes, at that time, he was not ready. Once they received it, they were not ready to, the dad was, but he wasn't ready to receive that information. So it was months later. And I think the only reason why the report came up is because at Montgomery College, they needed a report. And then he's, no, I need to read before I submit to
Right.
them.
That's also one of the many important reasons why it's important when you're having testing done for a child or teen to be able to have them include in the feedback session, because at some point they're going to need to know themselves. It's helpful at any age to understand stuff anyway, but there's the part where you really need to know more when you get older and have to actually submit the report. And
Mhm.
so it is helpful to not have that be the first time where you learn all the stuff about yourself by looking at the report when you're going to submit it to college for accommodations.
Yes. Yes, I think more parents and the teenager, I feel like we need to have stronger conversations about let's read it together before.
Ideally, part of the feedback session is to talk about, even if you're not going over the report specifically, to talk about the results so that this way they know the basics of what the findings are, even if they've never seen the actual report. But I think for anyone, for parents too, it's a lot to take in. It's a lot of information at once to go through in a feedback session, let alone when you're sitting reading the report.
Yes, I completely agree with that. Can you also walk us through when you do receive the report and you're getting all this information about the results? How can that directly help support the IEP goals and the supports part of it too? How does it
Sure.
help it?
So basically, you need the documentation to understand what's going on to then create the goals. Because basically, the goals are being used to help support whatever the challenges are. And so the report will often or usually identify what the challenges are and why they're occurring. So it's not just that it's not doing well in reading, but that maybe they have a learning disorder in reading. So that's a big contributing factor paired with maybe ADHD. So they have some trouble with focus as well. So then basically, you use the results from the testing to help guide both what the IP is coded as, but then also specific goals. So, in terms of what is their potential to be in terms of maybe a sense of improvement, how much of it is compensating versus building up those skills.
That is great to really take in. I love how you summarize in a way that's really easy for families to digest. I want to say that's something I feel like maybe you do talk to a lot of families because I feel like this, I tell families evaluations are so important, but I think they just get so scared or anxious, overwhelmed because it's so thick, the report.
Well, I think it's a lot to be handed a report of that length with all this information. Even if it was 10 pages, I think the fact that just based on what may be included and how it's written up, I think it may be hard to understand. But obviously, the fact when it's even longer, it's just even more intimidating because there's so much information. But again,
Yes,
that's why I think the summary section can make such a big difference, and having a thorough summary allows you to really read that and get all the basic information that you probably need to know.
yes. And I tell families by law that schools, they have to be given that option or every 3 years, the student must be reevaluated. But what should parents know about this triennial evaluation? Because I do want to share that often families know is like the child, for example, they would say, we already know the child has autism. We don't need to reevaluate just to see if they're eligible. What would you tell them about how important this triennial evaluation is?
Sure. Here's the thing. In theory, it's helpful to have an updated picture of things and to get formal testing for documentation purposes and in general, just to get a clear sense and make sure that you really know what's going on. Obviously, if a school doesn't feel like there's a need to do testing, isn't willing to, then you have to figure out what are your rights in terms of asking them to do testing if they feel like they don't need to as part of that triennial review.
Hmm.
A practical level, if they're going to take the SAT or the ACT, the laws, I guess, there have been some change recently in terms of streamlining the process for accommodations. But if you don't do testing in high school, any update testing, and they go to college, usually you then will need formal testing done privately in most cases in order to actually get accommodations at college. If you can get the school to do testing in high school or late enough in high school as part of a review, then it may save you having to do an evaluation privately in order to get accommodations in college.
That is actually one of the best advice I have heard. Thank you so much. Because I often tell them we had one student that was graduating. I was like, he's gonna go to college. We need an evaluation. And they were like, we just did two years ago, and he's gonna graduate. I guess he was due, I think it was like March. I think it was March, and his graduation's in May. So they saw no point of it. I'm like, the school where he's gonna go to will need it. So when you said that, I'm like, oh. Thank you. Thank you so much. Because it is needed when, like after. So sorry, you just got me excited.
Yeah, no, I think it's good to know all this information, but to also recognize that there's variability. So, for example, a lot of colleges do prefer testing that's done based on adult norms, and adult norms start at age 16. There are definitely colleges that will accept testing if someone's 15. Depends on the college and the variety of if you're going to test someone at 15 or 16. 16 is better because of the fact that it's adult norms, so there's more likely that you're going to get a longer time out of that report. But again, it's not the be all and end all in terms of getting accommodations because some colleges would take testing at 15, especially if there's a long documented history of challenges and they feel like that's sufficient. It just really depends on the school and how strict they are in requirements. But that's
Yeah.
why, again, it's hard at that age because you don't know necessarily where your child's going to go to college in terms of
Yeah.
contacting the school and seeing. But most colleges will have on their website like recommendations or requirements for accommodations.
Mhm.
So, if it's helpful, you can always look at schools your child may be applying to, especially if they're already at the process of applying, and see what they may require and use that as guidance in terms of update testing and things like that.
That's really a great advice for the Disability Resource Office at that college. So thank you for that.
Welcome.
Thank you so much for that advice. What if the school says no, that a triennial evaluation is not needed? How would you respond to that?
I think then I would look at what are the laws and what are the rules about it and what's the formal process to request it. If they feel like it's not warranted, is there an appeals process that you can go through to ask for it? Some of it is figuring out is there new potential information that suggests that there's other things that maybe the school's not aware of. So if there's a newer issue that's developed in a certain class or certain skill set, let's say maybe they never really struggled in math and now for this review they're suddenly having a hard time in math, maybe that's a sign that we need to do formal testing to figure out what's going on in math.
If they're going to be asking, just to make sure that the parents are prepared to answer why they do want to have this testing. So I think that was a great example that you gave. Thanks.
Welcome.
What are certain circumstances like regression, new diagnosis of trauma where parents should request retesting sooner?
I'm not really sure. I'm not an expert on the laws of each school system and how they do it. So,
Okay.
it'd be something you'd have to look at with each individual school district in terms of the rules around requesting updated testing sooner if there's a change in something. You can certainly usually request a review of the IEP sooner than 3 years, definitely, because usually it's the annual review. And if there is new information, you certainly can request an update to it in a meeting.
Yeah.
But I don't know the exact rules around requesting formal testing based on things.
I have seen it done. When I was a teacher, it was like 2 years and some months. And then by the time that they finally identify and evaluated that can get it done, they said it was like going to be 2 years and additional months for that. They were like, okay, we're approaching closer to that 30-year mark. So from my experience, it sounded like it can be sooner, but I think if it was a year later, that would be more difficult. But what I would suggest is finding someone like you that can do the evaluation and then they can share it off to the school so that way there can be more of a collaboration or to see how they can take that new information in because I can see how they can be like we just got testing done.
Right. Because also it's a little bit different, I think, to some degree at the high school level, for example, but in college. So if you look at a lot of colleges and their requirements for accommodations, if it's related to mental health reasons in terms of anxiety, depression, or other things, usually there's a requirement that the documentation is much more recent than learning disabilities and ADHD because of the fact that certain disorders can really change or fluctuate a lot in a shorter period of time. So I'm just sharing that because I think that's helpful to recognize that certain issues can really impact kids more quickly, and the course of something can change a lot faster for certain things than others.
Hmm.
And so I think recognizing that if a child has really bad anxiety or really bad depression, they could look drastically different 1 year to the next compared to learning disability or HD. Certainly there could be big differences, but it may not be quite as dramatic from year to year.
My daughter, did I mention to you that my daughter had 5 brain surgeries due to her seizures?
Yeah.
So I remember requesting an evaluation done prior to her surgery, but it was too soon, they said. So then what I did, I just got my daughter's private psychologist to help me get these evaluations done because for me, I wanted to see how much of a change it was going to be like before her surgery and then after her surgery because they told me it was going to impact her language. They just didn't know how much it was going to impact her language because they were trying to remove brain tissue and where the seizures started was they said in where the language region is.
Mm.
And then I remember asking, okay, now we're closer to the 3rd year, so I would like to have more testing done soon after her surgery. I remember saying, okay, it's been a month, but they wanted it to be longer but I needed to give my daughter's neurologist something sooner to see how much of an impact it was. But then I had to go do it privately. Again, I think if I were to give myself that advice, can you tell me more about what you think that the independent educational evaluation, have you seen parents go about asking for that for the school to cover it?
Not very often.
Yeah.
I mean, I've certainly heard of parents trying to do it. I don't know how often it gets approved, but it's obviously the process. I think it also depends on the school district. I know in some, they have a set rate that they'll pay for it, but the problem is trying to find a private person that will do it for that rate. That they'll actually cover it at is much less than anyone actually charges. I think it depends on how it works, or if it's more of a reimbursement for whatever the actual rate is, that may be different. But again, it's more hoops to go through. And then you have also the time involved in the waiting period and trying to do this all. And if your child's struggling now, you usually want to get the testing done to figure out how best to help them. That's where I think sometimes if you are able to, going to the private route is helpful because then you can get the testing done more quickly. Usually you have all the information up front, and then especially if it's a thorough evaluation, you have everything the school needs to then make a determination on setting up supports or updating an existing plan.
Yeah, I remember talking to, I think she was a special education department chair in Virginia, and she said that often when parents do request that, it's typically when they don't have like evaluators available. Well, they don't have psychologists and they don't have enough speech therapists. That's just really, really hard for them to acquire and get to do all of these testings. So they said typically when they don't have enough, then that's when they're more willing to work with the family to get that evaluation done. And then often what I've also heard is that they will pay like the difference. So even though the evaluator may not accept it at that rate, the parents will pay the difference.
Oh.
So that's what I've heard, but I'm sure that it varies from state to counties. So
All right, but that's good to know that in some cases the parents can just pay the difference because that probably does make it easier to get at least some of it covered then.
yes, anything helps. I think during that time, I needed that information sooner because we were approaching an additional brain surgery. So I think I just wanted to do that. But I don't want families to do what I did and just hurry, just get things done. But when there's something that can help, because raising a child with additional needs can be very expensive. Yep. And then also, can you please tell me the difference between the quality between a school-based evaluation and a private neuropsych evaluation?
Sure. Again, it really depends because there's certainly some school evaluations I'm sure that are reasonably thorough, support the needs, but there's probably some private evaluations that are not very thorough. But in general, I would say that more often than not, at least from what I've seen, a private evaluation tends to be a lot more thorough than a school one. And it's also usually altogether as one report, whereas some school ones are piecemealed with here's they did the Woodcock-Johnson for academics, here's where they did some sort of measure to look at cognitive functioning, and then it's a bunch of different reports put together as opposed to looking at everything all together as one evaluation. But I think the main thing is that there's also around like certain diagnoses schools will be hesitant to give if it's more of a medical diagnosis. And even if the data is there, sort of a private psychologist can certainly, I think, is probably more able to, in some cases, to give a wider range of diagnoses and be able to do more thorough testing if they see certain needs than I think a school even probably has access to.
Yeah.
I also don't know that, as far as I know, at least to my knowledge, I don't know that schools do formal neuropsychological testing. They do psychoeducational testing to some degree, but I don't know if they do like in-depth neuropsych testing, or at least refer to it as that within the school system. They may, but not to my knowledge. So that would also be something to look at. It's just even the type of testing that they're able to do in the school system.
Yeah. So my question, the school-based versus getting the private. And I think we talked about it before. It was more about the function or the need, what they were looking for the neuropsych. Because remember, we were comparing like the neuropsych with a regular psych evaluation. It's just that this is the type of question that I typically get because the parents believe schools are swamped. They're just so busy. There's no way that they're going to be giving their child, the students, enough time for these evaluations. So they feel that it's either rushed or they don't really know the child. And they're like, what if I do this evaluation done privately? Then it's more individualized, or they'll listen to the family more, or they can do assessments certain ways, even though it's standardized. I know, but this is like what parents feel. But I guess it also depends. I want to say it really does depend on the school district. Should they spend that extra money? Or should they first try out and see how the evaluation at the school is being done?
It's hard to say. I think it really depends on the circumstances. I think if, you're able to afford the private evaluation to start and it's not that big of a deal to afford it, I think you're probably better off doing the private evaluation to start because I think you're probably going to get a more thorough picture to begin with. It's going to be faster to get the results. And then you essentially know exactly what information is being shared with the school, as opposed to the school doing testing, seeing what they find, and then, figuring out if they think the person qualifies for accommodations based on that. So I think that the private evaluation definitely has a lot of value if you're able to do it easily. If it's a huge stretch financially, then I think it depends on the severity of the issues. Again, I think you're still in a lot of cases going to get a more thorough evaluation if you do it privately. If finances are a big concern, then if you can get the school to do the testing in a reasonable time period, then you can do that, see what it shows, and then supplement it with other testing if needed.
There was a mom that did the school evaluation, didn't agree with it because the child refused to go to school because of bullying. And then he was thinking about harming himself. But that wasn't really mentioned anywhere. And they were like, oh, we don't see what you're seeing. So then the mom had to do a private assessment done separately. And it was night and day. And with that evaluation, they were able to get permission to do virtual school for a while and then also get a teacher to come to their home until things settled down. But it also helped with their non-public placement. It also was good for her to do that assessment because then they had a stronger argument how the school sees him very differently.
Yeah, and again, each circumstance is different, so you have to use your judgment. But again, you can even talk to a provider to look at saying, we're considering doing testing privately based on X, Y, or Z factors. What do you think makes sense, or what would be your thoughts in terms of what proceeding one way versus the other? Worst case, a psychologist doesn't have a whole lot to say on it, but they may be able to give you good guidance if you're considering hiring them, but trying to figure out what does make the most sense for what would be in the best interest of the child in that situation.
Yes. Can I ask you also then, how does trauma and emotional disability show up in evaluations?
I think, like a lot of things, it depends.
I know, I'm
Um,
so sorry, but
I mean,
I guess,
it's certainly looking at emotional functioning. And again, this is another area where I do think that probably there can often be a huge difference between a private evaluation and a school one, because the emotional functioning is a school may do like a screening for them, but in most cases, at least from what I've seen, don't usually do very in-depth testing to look at emotional functioning. Whereas a private evaluation might be doing some projective measures to look at things, especially if a child can't report much. Sometimes the projective measures can be a really good way at getting at more deep-rooted stuff that they just either the child's not aware of or just can't verbalize. You just better understand like things about their interpersonal functioning and things underneath the surface.
yeah. Can I ask you, what do you think, how would the IEP go day to day at school go if these trauma or emotional struggles, they continue to go undiagnosed?
If they're the primary cause of the issues or exacerbating the other issues, then you're probably not going to reach the goals based on whatever you have set up in the IP because you're not targeted issues.
Yeah, I completely agree. In some communities, they just don't believe in depression. It does not exist. So I think it's very important what you just said that I really want to make sure that I highlight to families that have just difficulty, especially in the communities. Remember, I told you that my mom shared like depression. Now, later on, years later, yes, but then I also have other family members where they have their teenagers and they're not depressed. They're just lazy or they're just anything but that mental health disorder that they're not looking into. So thank you for sharing your thoughts on that.
Yeah, absolutely.
Yes, and then, but how can parents, those that do see that, for example, I have families that they take anti-seizure medications. I belong to different support groups, and then one of them is an epilepsy support group that I go to for my daughter because I want to understand the medication that she's taking and how I understand every person can take in the medication differently. They have different experiences. But one of the things that they shared with me, taking these anti-seizure meds, it often makes them really depressed or have suicidal thoughts. And it makes me nervous. And I remember being there with another parent, and then they were talking about how the doctor saying, I'm sorry, I guess this is kind of difficult for me to say because my daughter takes anti-seizure meds and she can't tell me about her feelings. She can't, all I know is that some days it's hard for her to get out of bed. So when I tell this group, my daughter is having, even though it's my daughter, it's not my experience, I'm just telling them about the different things that my daughter's experiencing. They were like, it sounds like she has severe depression. And then they tell me the things that were going in their heads, and they never thought about suicide before. And then I told them the medication that my daughter was taking in, and then they were taking in that medication as well. And then there were also other teenagers there, it's like young adults, because my daughter's 16, there's young adults and teenagers, and they allow me to go in and just ask them questions. I don't stay there too long because it's their space. I'm just asking how they're experiencing it. But one of the things that I remember hearing is the teenagers, there were two of them, they were having these really negative thoughts. And then they were telling me that's how it started. And then they couldn't stop. And then what helped them was stop taking the medication. So I'm telling you a background story because how can parents make sure that mental health recommendations are actually written in the IEP? I guess it was difficult for me because my daughter can't say certain things, but these teenagers can say certain things right to the school. But then it's another barrier to get their parents to also understand what their bodies are feeling with the medications. So, how can we get the school to also help? I don't know. Maybe it's a trick question for you. I'm so sorry. There's
It's
so
so
many
hard. I
different
think you
pieces
have to
here.
I think you have to have the school understand what the issues are in the first place, and for them to recognize that the mental health piece needs to be put into the IEP in some shape or form, if that's a big piece of the challenges. But it
Mhm.
also is hard because the question really becomes, I mean, taking medication is not necessarily it's not a school support. So it also comes a question of if anything about mental health is in there, typically it would be around a support at school related to it. But if there's no supports at school that directly relate to it, then there people are aware of it, but it doesn't have the same impact because there's other than the knowledge of it, it may not be something formal that a school is doing related to it. It again depends on the circumstances.
But how about schools? They just focus on academics and they don't really see the part of the social emotional findings. If they do see it in the reports, but they don't go about that to try to help with that part of it, even though in the reports it's saying that they're having hardship with it. How can the parents advocate for the school to be more supportive and focus more on the social emotional needs that the child needs?
I think just asking for social emotional goals in the IEP.
Yes. And then what have you seen in the accommodations or supports? Can you
I mean,
share?
I guess it depends. I guess a few I can think of offhand would be like something like a flash pass to go see the counselor is needed. I think occasionally I've seen if there's real concerns with getting up because of some of it, being able to have the schedule set up where there's a late start. Again, I don't think that one's very common, but occasionally I've seen that, like something around the hours of school. But that one I think is a lot harder to get. But I would say the most common ones are flash pass to the counselor, being able to exit the classroom in general easily if there's a lot of anxiety or panic attack.
Yes. Yes. One of the things that I have also seen, I didn't request for this for my daughter, but they recommended art therapy. When I shared about how Aaliyah was having like a hard time getting out of bed and telling them about the new medication and how it was impacting her body, they offered art therapy. I know for other families, what they've added more like counseling hours in the IEP. So that way, aside from speech therapy, they have those counseling hours that they can definitely talk to the counselor. Can I please ask? When a parent is feeling overwhelmed, how is it best that you would suggest for them to be prepped for this IEP when they're talking about the evaluation?
One, I think if you can have someone there to help you, whether it's an educational consultant, the person that did the testing to come and present the findings, having someone else there to help guide you through the process and also explain ahead of time what to expect, I think can help reduce some of the anxiety around an IEP meeting.
Yeah. And then what questions should parents ask? I know that's a hard question though, but what questions do you think the parents can ask in the beginning to just have an easier start to this important meeting?
I think just having some sort of acknowledgement that ideally that we're all on the same page to try to help. And because I think that trying like a team collaborative approach to start, I think can often help. Because I think if there's certainly, I'm sure some meetings can definitely get very adversarial. And so I think if the tone can be set at the beginning to be very collaborative and that the parents are there, they want to help support, they're not there to push the school just to give tons of accommodations, but they want to work together to help support the child, that may go a long way towards more collaboration as part of the IP process.
Okay. And then my last question is, do you often go to IEP meetings? So, meaning, can you go with the families? So, if they were to want to work with you, are you okay with going to the IEP meetings, or is it more that you support them and get them prepped for the IEP meetings? Because sometimes, a lot of times, parents just don't want to go alone.
Yeah, it depends on the circumstances. I definitely go sometimes to IP meetings, or these days, a lot of times they'll pull me up on video to go over the report with people during the meeting. So it depends. There's sometimes where the parents feel uncomfortable having me present, and so I'll be present either there or virtually for it. And other times where they feel like just as long as the school reads the report, that's sufficient for them understanding what they need.
Would it be just families here in Maryland, or can you also support families in other states?
As long as it's a state I'm licensed, because I can see people in 43 states. But in most cases, it probably would be either someone I've done testing for or someone I'm working with regularly. But obviously, if I'm working with someone regularly or doing testing for, presumably I'm able to see people in whatever state they live in or the school's in. So I would be able to help people in other states as well.
Great, thank you. Yes, because I strongly feel that you're an easy person to talk to, meaning sometimes there are providers that just don't feel very comfortable answering certain questions. And you have this very friendly, easygoing, very comfortable. And plus, you didn't get annoyed. So me asking you all these questions. So I think these are really great qualities. And you're so well informed. And I love how you break things down. I don't know if you remember, I kept on saying, "Ooh, I like that you said the word guide. Ooh, I like this one." So I just love how you break things down for families, and you made something that can be very overwhelming and then just made it really easy for families to understand these are the sections that I want you to focus on. So thank you.
You're welcome. Yeah, thanks for the kind words.
Yes. Okay. Thank you so much for this second part of the interview. I will be sure to share your information. Is there anything else that you want us to know for your upcoming projects?
Let's see. I guess that my fall boot camp is in full swing, and it's basically a one-to-one session, really focused on whatever executive function skills people need support with in terms of time management, organization, keeping track of assignments. It's a nice way to jumpstart things, especially with the second quarter starting
Yes.
in the county. So I've been doing a bunch of those. The boot camp is in full swing. Certainly continue to work with a lot of kids and teens and really navigate stuff now that I think the honeymoon period of the school year is definitely over. And I think the workload tends to pick up a lot in the second quarter. That's definitely a good time in general. If things are not working quite the way you want them to be, it's good to take action now rather than waiting until the end of the first semester.
Completely agree. Yes, I remember last time we were talking about because not a lot of families really understand what executive functioning means. So maybe if it's okay, now that we finished talking about assessments and evaluations, can we please, when you have some time, I know you're super busy, but maybe in the future, if we can do another episode on executive functioning?
Sure, absolutely. Yeah, I'd be happy to.
Great. Thank you so much. Okay, I hope you have a great day.
Thanks, you too. Thanks again for having me on.
Thank you so much for joining me for episode 13 and part 2 of our conversation with Dr. Heller. I'm truly grateful that we had this extra time with him. Parents need that deeper explanation, not surface level answers. If this episode helped you feel clearer, stronger, or more prepared for your next IEP meeting, here are your action items before you go. So the first thing is, please don't forget to subscribe or follow the podcast so you never miss an episode. Please leave a quick review. This helps us more families discover the show. Please share this episode with a parent or educator or advocate who needs it. Download your free resource in the show notes, including your IEP documentation guide, and visit our website at www.startingwithiep.com to explore workshops, advocacy tools, and upcoming parent trainings. Apply to be a guest on the podcast if you're a parent, educator, therapist, or professional with a story or expertise to share. I would love to hear from you. The guest application is on our website. Thank you for being here, and thank you for showing up for your child. And thank you for growing with me. I'll see you on the next episode. Bye.